Hi everyone. So, have you know how to treat the individual who consumed the pesticide, organophosphates or snake bites, and why the people use belladonna for increasing of the beauty of eyes? Okay. So, we will try to answer these questions. So, today our topic is parasympathetic nervous system. So, here parasympathetic nervous system, it is also called as rest and digestion. We already covered the sympathetic nervous system. Now, we are discussing about the parasympathetic rest and digestion. So, you can see the properties of the rest and digestion. So, for the digestion you need higher secretions. All the glands has to secrete higher quantity of this. So, obviously the secretions are going to be increased in this, and muscular movement is going to be reduced, and gastric motility should be increased for the proper digestion. Okay. So, and meiosis, there no need of dilation of this pupil. So, meiosis. So, all these are the some characters of this parasympathetic nervous system. When it gets stimulated this, so these are the characters are going to be seen. So, before going to that, first we will see what are the anatomical differences between the sympathetic and parasympathetic. Then we will see the neurotransmitter present in and different receptors. Okay. So, here assume this is the brain and this is spinal cord. Okay. So, as like sympathetic nervous system, so parasympathetic nervous system is eliminated from this cranial and sacral region. Okay, the nerves are going to be protruded from this cranial and sacral region. So, here in case of this parasympathetic nervous system, acetylcholine is the only neurotransmitter present. So, here preganglionic and postganglionics are going to be situated far from the spinal cord. This is one of the difference between the sympathetic and parasympathetic nervous system. Next, coming to this receptors. So, here we have muscarinic and nicotinic receptors, and there is a subtypes M1 to M5, and nicotinic receptors NM to NN, neuronal, nicotinic neuronal and nicotinic muscarinic. So, here, so first we will say like how this acetylcholine is going to be synthesized. So, acetylcholine is going to be synthesized by, so here there is a symport of the choline with the sodium. So, here the choline is going to be import along with the sodium, choline is going to be imported, and is going to be bind with the acetyl-CoA to in the presence of choline acetylase transferases. So, because of that the acetylcholine is going to be prepared and is stored in a vesicles. So, when any stimulus is generated, so obviously there will be opening of the calcium channels, so that causes the leaking of these acetylcholine from this vesicles and is going to be released in this synapses. Okay. So, once this released is going to be bind on the postsynaptic receptors and is going to be elicit its action. Okay, when there is a excess of this acetylcholine is there will be a negative feedback mechanism, thereby the acetylcholine secretion is going to be regulated or controlled. Apart from that, we have the choline esterases enzymes which will degrade the acetylcholine present in synapses and is going to be converted into acetyl group and choline. So, this choline is going to be further utilized for the again to prepare the acetylcholine to continue this cycle. So, this is how the acetylcholine is going to be prepared at the nerve synapses. Next, we will see, say for example, so we were discussing about the snake bite, right. So, here snake bite, when the snake bite is there or any pesticide, if any individual is consumed this pesticide, so what happens, these are going to block this cholinesterases. Cholinesterase enzyme is going to be inhibited by these agents, organophosphates. So, resulting of that, here the presence of the acetylcholine is going to be enhanced. So, when the acetylcholine is enhanced here, so obviously we will get various adverse effects. Say for example, so here because of the increased acetylcholine secretion, so you can see the higher salivation. So, the individual is going to be foam is coming from the individual. So, that is because of the higher salivation. And because of the higher concentration of the acetic acid, so acetylcholine, so here there will be drastic reduction of the heart rate. So that causes the hypovolemia, dilation of the blood vessels. Okay, that causes the death of the individuals. So here we can treat the individual by giving this anticholinergic in this case. So apart from this, we will discuss about the Coulomb-mimetic drugs, the agents which will mimic the acetylcholine because of the structural similarity. So these drugs carbicol, pilocarpine and bethanicol are similarly act as acetylcholine. So acetylcholine, if directly given intramuscular, intravenous, so here what happens? So pseudo acetylcholinesterase enzymes are going to be break down this acetylcholine. So that is the reason the therapeutical activity of the acetylcholine will be 0. To prevent that, we will use this modified chemicals carbicol, which has the similar structure as like of the acetylcholine. Apart from this, we will use this indirect acting reversible inhibitors, example physostigmine, neostigmine and pyridostigmine. So these agents simply block this acetylcholine reversibly. So up to some time is going to be block this acetylcholine, resulting of that the acetylcholine concentration is going to be increased. So we can have the therapeutical effect. So if you say this, the presence of the receptors are going to be present at different locations. Say for example, M1 is going to be concentrated on the gastrointestinal tract, M2 is going to be concentrated on the cardiac muscle, and M3 is going to be concentrated on lung and smooth muscle. So depending on that, so here the activity can be seen for these particular drugs. Next, irreversible acting drugs, example sarin gas, so which is used in wars normally, sarin gas. Coming to these pharmacological actions, if this has the similar structure as compared to the acetylcholine, it has the same properties. So like CVS, so it's going to depress the CVS and it causes the dilation of the blood vessels and increase the peristaltic movement of the gastrointestinal tract, and the secretions are going to be increased likewise. So we can see the same symptoms as the acetylcholine. Next, coming to the anticholinergic agents. So these are the agents which will useful when the acetylcholine concentration is increased. To counteract this acetylcholine, we will use this anticholinergic drugs. So this is our basically of 3 categories: antimuscarinic, ganglionic blockers and neuromuscular blockers. So muscarinics are normally work at the receptor level. So here M1, M2, M3 located at different organs. So here the muscarinic drugs are going to be bind to this specific receptor and elicit its activity. So coming to the ganglionic receptors, these are going to be bind with the ganglionic region. So here ganglionic region, so normally nicotine is going to work here. Then neuromuscular blockers, these are the neuromuscular where the neuron and muscle is there. So here neuromuscular blockers are going to be used. Example for the antimuscarinic agents, scopolamine, which we will use as a to treat the motion sickness. Ipratropium, it is to contract this bronchi to stop this the running nose. So we will use this. Adverse effects coming to this: agitation, blurred vision, constipation, dry mouth, sweating. So what is the properties here? Entirely the reverse activities can be seen here as a adverse reactions. Next, ganglionic blockers, nicotine. So if you smoke, so normally is going to be stimulate your CNS and is increase the blood pressure and the heart rate. So because of the binding this particular region at the ganglionic blockers. So next, neuromuscular blockers. So normally the arrow poisoning is used pancreonium. So here what happens when the neuron and muscle contact? So here is going to be get paralyzed because of this. So resulting that the animal is going to be partially paralyzed. So it is easy target for the hunter. Okay. So this is a brief introduction regarding this parasympathetic nervous system. Hope this video is useful. Thank you.